All right, you guys, I'm going to do my spiel again, but we are recording. Welcome to Bariatric Meetup. This is hosted by East to West, WLS. My name is April, and I'm the West part of East to West. Jason is here, my friend. Why don't you introduce yourself, Jason?
I am Jason, and I am the East from East to West. I live in Jacksonville, Florida.
And we are so happy to be a part of and support the bariatric community. Jason and I have both had bariatric surgery. I had vertical sleeve gastrectomy almost 2 years ago, and I've lost 120 pounds. Jason, what about you? Where are you at?
I am about 18 months out, I believe. Maybe 16. Y'all know I can't math. 16-ish months out, 18 months, somewhere in the between there. And I am 186 pounds down as of today.
Just amazing. And we know that everybody that is here is either considering bariatric surgery, has had bariatric surgery, or has lost a significant amount of weight and is looking to also have plastic surgery because they've got some loose skin issues. So welcome, everybody. We're so thankful that you were here. We are so excited to dive into our topic today. If you're just arriving, please, and you're watching this live, please go ahead and introduce yourself in the chat. If you'd like to, you can share your handle, where you live, if you're pre-post-op, all that kind of good stuff. We love to get to know everybody. So today, we are welcoming three amazing people from our community. Miss Natalie could not join us. She had a bit of an emergency, so she won't be here tonight, but we do have three outstanding experts that we get to talk to and interact today. Miss Des, Dr. Gavin Dry, and Melissa Dry. Welcome, everybody.
Hi, thank you guys so much.
We're so excited. Des, why don't you go ahead and quickly introduce yourself, and then Dr. Dry and Melissa, why don't you go ahead and follow Des?
Hi guys, I'm Des on Instagram and YouTube and TikTok. You can find me under Woke Up Like Des, little play on words there. I also had weight loss surgery. I had the gastric bypass back in December 2017, so I'm now 3.5 years post-op, if I'm doing math correctly. And it has been a whole journey ever since. I've done the whole thing with the weight loss surgery and then the plastics, and then now I'm working on bodybuilding and working on toning and building muscle. So I kind of have this whole journey. It's got lots of different chapters, and I'm just kind of known for being the open book and the person to document it all. So that's why I'm here, and I hope to be able to share and help all of you guys just through my own personal experiences.
And we are so thankful for Miss Des. She's joined us multiple times on the podcast. We also recorded with her today, and it is straight fire. And I will let you know, Des is the person that you see here. We literally connected with her by a direct message through Instagram, and now she's my best friend forever. So she's a real person.
Love you.
Oh, goodness. All right, Dr. Gavin and Melissa, please introduce yourselves.
No, that's great. Sharing the love from Des, which is fantastic to all you guys. I'm Dr. Gavin. I'm Dr. Gavin Dry. It's my lovely wife, Melissa Dry. I'm a plastic surgeon in the Seattle area. Been doing this for probably just over 20 years or so. And I mean, I'll tell you a little bit more about myself when it sort of comes to my time to say that after Des, but enjoy every single part of being in the weight loss community. I have a personal affiliation and a personal connection to it from my own story, which I'll share in a bit as well. But I love being a part of it and being joined with the rest of the group. So happy to do anything, happy to share any questions, answer any questions that you may have today. Anything that I can do to help would be fantastic.
Wonderful.
And I have been a nurse for 16 years and worked in healthcare for a little over 20 years, and have worked in the aesthetic industry for about 17 of those years.
Oh my goodness. We are so thankful for your expertise, and we thank you for volunteering your time to join us tonight. This is so helpful. And it's a wonderful way to really become comfortable in the decisions that some of us might make after bariatric surgery. So thank you to all three of you guys for joining us. We very much appreciate your time.
Anytime.
All right. So you guys know we always start off the VBM by talking about our ground rules. Our mission is to support the bariatric community with humor, humility, and honesty. Our goal is to destigmatize weight loss surgery so that more people know that this is an option to find and live at a healthy, happy weight. We want to grow a community of patients for patients, and we want a safe place to share ideas and kind of learn and grow about what we are going through as bariatric patients. Our ground rules: please always assume best intent. share what you are comfortable with sharing publicly, right? This is recorded. It will live on our YouTube channel so that others can access this amazing resource. We are not here to sell you anything. We are simply here to learn. If we see any nudity or violence or isms in the screens or in the chat, we'll just remove you. And keep in mind, this is not medical advice, right? Even though Dr. Dry and his wife are here, they are not your medical professionals. We are speaking from our patient perspective. So just know this is simply a place for community to gather. I think that's about it. Did I miss anything, Jason? We good to go? You guys
Yeah,
good?
I think you pretty much nailed everything. Yeah, we'll just, any questions, anything you may have, put it in the chat. We'll make sure and do our best to monitor those. And that's about it.
All right, perfect. All right, you guys, our quick agenda for today. We're going to start off with Des. We're going to learn her plastic story. We have some questions that we want to ask her. And then we're going to connect with Dr. Dry and Melissa to really talk about just some of the questions that we would like to ask the experts before we actually make a decision about weight loss surgery. So like, when is the right time to have it? How do we know what procedures we need? Kind of those types of questions. So if you do have them, again, unmute yourself and ask when that time comes. You can put it in the chat and we will make sure that it gets asked. And then as always, we like to reflect on what we learned today, and we're going to give you a little look ahead to what is coming up in the future. Our podcast, East to West, you guys, is sponsored by 4 amazing entities. Gather Juice Company in Tacoma, Retreat Drinks in Gig Harbor, Washington, Grit City Cairo in Tacoma, Washington. So if you live locally, these are some amazing people to patron. You can also support them by following them on Instagram. That's a huge support for them. So even if you don't live here, you can give them a follow. You can let them know that you appreciate their support of East to West. And then of course, our patrons. Oh my gosh, you guys, we cannot be doing any of this without the support of our patrons. And it is a freaking rad group of human beings. We cannot thank you guys enough for your support. We'll talk about it later on, but if you'd like to become a patron, you can do so. And we very much appreciate that. Okay, to the good stuff, to what we're all here for. Miss Des.
To the good
All
stuff.
right.
Insert photo of Des. I love it.
There's a photo, just a photo. All right, my friend, I'm going to stop sharing my screen so that you take up the full thing for everybody. I have the questions written down here so that we know what to ask, but really, Des, what we would like to know for you is, how did you make the decision to have plastic surgery? How did you go about finding and selecting your surgeon and your procedure? And then has plastic surgery kind of done for you what you were hoping it would do for you, if that kind of makes sense? So I'm going to stop sharing and the floor is yours, my friend.
Okay, awesome. So yeah, before I even had weight loss surgery, I spent probably about 3 years researching it because it's a big decision to make. And when I was first recommended by my primary doctor about, getting weight loss surgery, I was only 20 or 21 years old. And everyone in my family was like, you're too young to get a surgery. Don't you want to try it the natural way? It was like terrifying to think of 21-year-old Des going into surgery. And so I just obviously wasn't trying to jump the gun, and I wanted to really know what I was going to get myself into. And there was just so many other things like playing into it. And it just took me 3 years of researching. And throughout that entire process, I found other girls who were around like my same age, same stats, like weight and height, that I could follow along with, which really helped me get prepared for like what to expect. And it just so happened that the year I got my gastric bypass surgery, one of the girls I had followed a long time ago, her name's Kayla Calderwood. She used to be like more into like the influencer thing and share about her weight loss journey, but she's never on Instagram anymore. So I don't even know if she like posts anymore, but this was like forever ago. So Kayla was actually going into her plastics the same like time I got my weight loss surgery. And I just remember thinking, oh, wow, it's like so full circle. And everyone was telling me like, oh, Des, you're getting it at 23 years old, 25 years old, like your skin's gonna bounce back, like no problem. And well, I will be the first person to tell you it did not just bounce back. And I noticed that with the girls that I was following on Instagram, that it doesn't really seem that with rapid weight loss, with weight loss surgery, your skin really bounces back. That's more like if you do it, the natural way, and it's more of a slower process. Yeah, losing a lot of weight, you're going to have like excess skin. But if it's a slower process, I think it does tend to bounce back, and like your elasticity is a little better. But yeah, with extreme weight loss, like losing 150 pounds in 1 year for me, that's how fast it was. I had loose skin and there was nothing I could do about it. So I'd say that once I like kind of like started this journey, I knew like okay, I'm getting my surgery at, I think I was 25 years old when I got it. No, I was 24. So I knew that, hey, I'm getting my surgery at 24. My whole life's about to change at 24 years old. I'd say that that's young enough to consider getting plastics even before I have kids or whatever, because I just wanted to be able to enjoy my body for the first time ever. And following these other girls, I saw that they were getting it. So I just figured that's kind of like the full circle thing to do, right? So go into that expectation that it might be something that you might want to consider. So I ended up going through the weight loss surgery in December of 2017, and I lost my 150 pounds in my first year. Literally the week that I hit my 1 year post-op was the same week that I hit my goal weight. And I hit my goal weight on my birthday, December 23rd, had my 1 year on the 29th, and then, all of that. But I decided like, okay, I lost my 150 pounds and I have a lot of extra skin, and I wonder if I could maybe tone it up and like build muscle to help fill it up, especially on my arms. Like maybe I could fill the loose skin with muscle. So that's when I kind of started my journey to reconstructing my body. Is kind of like what I refer to this area of my life. It's like, okay, I lost the weight, but now like I want to build a body that I'm proud of, and I want to see some tone and like definition, because I'm in the gym every day and I want it to look like it. Like, sure, I lost some weight, but I felt so thin and just kind of like energyless. Like, I don't know, I was like lifeless.
Well, and Des, we talked about this when we were recording the podcast episode today. I think some people go into plastic surgery thinking I'm going to have all the skin removed, and all of a sudden I'm going to have all this muscle definition.
Oh
And
yeah.
it's like, if you're not working out, if you are not actively building this muscular system underneath your skin, weight loss surgery isn't, or plastic surgery isn't all of a sudden going to give you a six pack, right? I mean, it's like, there's so much more that goes into acquiring or building the body that you want besides the tool of plastic surgery.
Exactly. Like for me, my tummy tuck only removed my excess skin. And apparently people are so shocked that I still have stretch marks. I still have loose skin in other areas of my body. I'm not a Barbie doll. What? She had a tummy tuck, but she has cellulite. She has stretch marks. I see dimples. There's still loose skin and rolls and back fat and all this stuff. I'm like, yeah, because a tummy tuck doesn't make you perfect. Weight loss surgery doesn't make you perfect. And like, that's like the big reality check, is that like, we're doing these big extremes, but we're never going to be your idea of perfect. So
No.
yeah, it's still there. But yeah, so once I hit my first goal weight of 150 pounds, I lost 150 pounds. Then I was sitting at 150 pounds, and I signed up for my first coach, and I started tracking macros and doing actually like organized workouts. So I had this many leg days, this many upper body days. Like I wasn't just going into the gym and working on, lifting weights, whatever. Like I had a plan, I had a coach, I was ready to go. So I had amazing results from doing that. I was already starting to see way more definition, and tracking macros totally changed everything. And after about like 6 months, I was like, okay, I've been maintaining my goal of like my 150 pounds lost. Like, I think I can start to consider my plastic surgery. Like, that's what I always tell people, is that you should take some time to maintain it. Because I get messages all the time. People are like, I'm 20 pounds from my goal weight. I want to start looking at a tummy tuck, all this stuff. I'm like, whoa, hold on. You might lose more. You might, like, have you felt your loose skin? Like, is it loose skin? Do you still have more to lose? Like, you should, like, not jump the gun and maintain that weight loss. That's just my recommendation. Like, you don't want to jump into it.
Well,
and there's just so much research you should do before you jump into it.
And we were talking about this today. Actually, so we recorded with Katie today. Hi, Fred. But Katie and I, we were talking about this in the podcast with you too, Des. It's like, I'm almost 2 years out, but I've dropped 2 pant sizes in about 3 months, and I have done nothing different. So my body is still changing. And that's, I think, the question that's in all of our heads is, when do I know when the right time, to have plastic surgery is? And I'm sure that Dr. Dry can address this, but I love your suggestion about, like, you just need to chill and figure out if you can maintain your new low weight or whatever that happy weight is before you maybe do something drastic again, in your body. So how did you pick your surgeon, Des? What process did you go through? And then how did you pick your procedure?
Well, my first resource was Instagram, of course, because that's where I find everything. Even if it's like, I don't know, I'll be like, my area code, like 805 brows. Who's going to do my brows today? I use Instagram as like a research tool all the time. So anyways, so I went to Instagram, and I live near LA. So I typed in Los Angeles plastic surgeon, Beverly Hills plastic surgeon. And I just kind of started finding people, and I would look through like the links on their website, or if I saw free consultations, then I'd be like, perfect. And then I went to like 6 or 7 of them for my tummy tuck and my boobs. And then eventually I was connected with Dr. Corindian, and he was in Beverly Hills, and it was like an hour from my house, and it seemed like everything was working out really nice. And I felt comfortable with him. I met with him 4 times before I said yes. Like that's how, I'm just not an impulsive person. Like I can make really big decisions, but it takes me a while. Like I have to really think about it and feel good about it. So I saw him 4 times with new sets of questions, and just like more like, I want to just like sit and talk to you. Like, what do I expect? And then I would go on Instagram and be like, all right, this is what I found out. Like, what else should I ask them? Like, what else should I ask? So, you know, it was kind of just one of those things where I really wanted to put in the work to feel comfortable and confident with whoever I was going to go with, and see lots of pictures. And yeah, just like know what I was getting myself into, just like I did with weight loss surgery. I'm always doing my research. I want to see what's up, like everything.
Well, and you even said that you met with multiple plastic surgeons and kind of asked the same questions so that you could see what everybody else was recommending.
Yes.
So, and then the other
Yeah.
thing that really surprised me about our conversation this morning is you were like, I went in for a consultation for like this one thing, and I left out like looking like a Crayola doll because I had marks all over my body, or they told me there was 50,000 things wrong with me. And it's like, well, just fillet me, take off my skin and put a new one on them because this is so horrible. Like,
Yes.
right. So what was that?
Oh yeah.
What was that experience like for you? How did you get to the point where you were feeling okay about plastic surgery and about having just the 2 that you eventually had done?
Yeah, well, you know, obviously, like when you're going into things like plastic surgery, pretty much the main thing you're thinking about is money. So you're just like, well, of course, I noticed all those imperfections about my body too, but I don't know if I'm exactly willing to pay double more just to fix that one little thing that I thought I was the only one that noticed, you know? So you're like, okay. But like, that's the other thing, is that when it comes to going to these consultations, that's why I tell everyone, like, you should go to a few different consultations, like multiple, get different opinions, because if every surgeon you see is telling you, I could fix this and maybe this would help you, you know, whatever, then maybe consider it. But I went to like 6 different consultations, and at least 2 of them were the only people who like told me random areas. Like one surgeon was even like, yeah, you have a lot of loose skin right here on your neck. Like if I go like this, I could pull it and I could cut that off. I'm like, but I don't ever do this. And it doesn't bother me from the side. Just because I can grab it doesn't mean, you know, so it's just like extra little things like that where I was like, you're trying to swindle me right now. You want more money. Just say it. That's what you had to say. So I was just like, okay, like don't just take everything that they say, because you know, you don't want really expensive. I'm not gonna lie. Like some people tell me, oh, go get your boobs done in Texas and it's like 3,000, but like every surgeon here in Beverly Hills like 10 to 12K. So I'm just like, I don't know. Prices are just different for everyone. Yeah. And that's another reason why you should just go to different surgeons, because it's gonna be different prices, and depending on what you need, there's different tummy tucks that you can get. That was another thing I learned. Some surgeons wanted to do the FDL, where it's like, I forget how they say it, but it's like fleur de lor, it's like French or something, but it's the line down. Thank you. That one. I got Dr. Dry's approval. But yeah, so they have that one. It's like the one that goes down there, and it's like helps with the loose skin up here, which I definitely have. So then that's something else we can get into. I'm like, should I have done that? You know, like I only did hip to hip. So there's that. And then there's the hip to hip where I did, where it was like just the skin that was hanging was removed. There was nothing else done. And then there's even like the 360 where you got all your loose skin cut all the way around. And then I have loose skin on my back too. So I'm like, maybe I could have done like a 360 with an FDL. So like there's so many different options, and that's why everyone's like price and, you know, recommendations would be different, because it depends on where your loose skin is at, what your body's looking like. And everyone's always like, how can I tell if this is loose skin or fat? The surgeons, you should ask the surgeon about it, because they'll feel your skin and move it around and be like, oh yeah,
that's literally why they have pieces of paper hanging out on their wall that says, I know how to answer that question. That's why you go to them. Amazing.
So, yeah.
So
that's like pretty much the starting part.
Okay. There are tons of questions in the chat, you guys. Thank you for putting them there. The last question that I had to ask for you, and then we'll dive to these questions. We'll get into a couple of them, Des, and then we'll move to Dr. Dry and Melissa, is what were you hoping plastic surgery would do for you? Part A. And part B is, did plastic surgery accomplish that for you?
So the main thing was that I just wanted to, for the first time in my life, feel comfortable and confident in my own skin. And I'm, obviously on my way with losing 150 pounds, but I felt like the loose skin was holding me back. And I still noticed it. I worked with it. Like, I still owned it. Did the best I could with it. But eventually, I wanted to really see like what life could be like without that feeling of just being held back, and like really just being able to see your progress and everything. So just feeling more confident and comfortable in my own skin, and being able to just like feel better and like not even worry about those little things like, do these pants like show my loose skin more? Is this compression enough?
Oh,
How compression are those leggings? Just like those things. So for me, it was absolutely worth it. Now I will say, like I mentioned earlier, you think, oh, you get your tummy tuck, you're gonna get your loose skin. My loose skin is gone. I'm never gonna have to deal with it again. I'm telling you guys right now that even getting a tummy tuck, my body was swollen for like 6 months, and I had no definition on my stomach. Like there were no abs there. I had to really get to work in the gym to have even the little bit of definition I have now. And by that, I mean, I've got like an oblique line. Okay. Like my abs are still not popping. You don't go into a tummy tuck and come out snatched with a 6-pack. It just doesn't happen. And you probably will still have stretch marks, cellulite, dimples, loose skin in other parts of your body. And I think it's just like one of those things where like we all need that reality check, where getting one procedure, whether it's even weight loss surgery, getting one surgery, getting weight loss surgery, getting a plastic surgery, any skin removal, it's not going to fix all your problems and the imperfections that we see or other people see. So like that's the reality check, is does it turn you into like what you probably think you're going to come out looking like? No. But do I feel a lot more comfortable and confident? And do I think it was worth it? 100%. 100%. I would do it all over again if I had to. I probably will after I have kids.
right? It's almost
Like I said earlier, the only two things that make you perfect in pictures are airbrushing and Photoshop.
Absolutely.
right. All right, you guys, let's move to some of your questions. I want to make sure that we have plenty of time for Dr. Dry and Melissa, but Dee, you had a question. Would you like to ask it? Dee Arrero.
Oh, yeah. Hi. Sorry. This is Debbie. Yeah, I'm actually 4 weeks out from a lower body lift. I went to Kayla's doctor, Dr. Katzen, and I got a lower body lift and a breast lift and augmentation. I'm recovering. It's been the toughest. I've had 3 C-sections, 2 weight loss surgeries, and this is the toughest recovery I've ever had. But I wanted to ask you, because I watched all your videos before I went and had surgery, and you had some complications. Can you talk about the emotional side of all of it? Because I feel like the emotional part of it has been really, really tough for me. So anything.
Yeah, no, if anything, the emotional part is the hardest part, because when you think about it, like if you're like, for me, I had like an infection, and I had like an allergic reaction and like a rash. And for me, it's like, you think about those things, and you can hold on to hope that with time it's going to get better, and like, just know that like it's going to get better. But then I know, like, I've had like one of my girlfriends, she went and got a tummy tuck, and when she was under, they ended up not being able to do it, and they didn't do her tummy tuck or her implants, and they told her that they just decided to do a lift. And it was like, she went in and got nothing that she thought, and like she was really, really sad, because she was like, I've been preparing for months for this. And like, it's just disheartening when you know, like, you're going into this and you're so excited, your whole life's about to change, your body's going to change, you can feel in yourself, you're excited, and then these like speed bumps come in the road. And like, for me, I feel like I actually do a pretty good job of like accepting the speed bumps that come in my life. Like, honestly, my family jokes to me about this all the time, because I have this like really bad luck. Like, I don't know why, just bad things sometimes happen to me. Okay, not sometimes, it happens all the time. Like, it's one of those things where like, that would only happen to you, Des. And so like, it's just like one of those things where I feel like a lot of these speed bumps that come in my life, it's literally God-given, because he's like, I'm going to do this to you because you're strong enough to tell a story about it and like show people the light at the end of the tunnel later. So I'm like, okay, you know what? Put me in. I got this. I know I'm going to come out stronger from it. I just got to get through it first. And I know that all it's going to take is a little time. So I always think like that. I'm a very hopeful person. I hold on to hope. Sometimes I feel like it's all I've got left. And like, I just, I know it's like not like a tangible answer on how you deal with it, but I try to keep my spirits up and I try to be hopeful and positive. And for me, even just in my daily life, when I know, all right, I'm going to have to really practice positivity today. I'm having a day and I literally have my, like, cause for me, I am a positive person. So it's rare when I'm not. And like everyone notices it. They're like, something's wrong with Des. Like, what? What's wrong? If I'm not smiling and laughing, all of a sudden everyone knows like something's wrong with Des. So it's like, okay, like sometimes I have my rough days too, and you just got to practice positivity. And I feel like that just kind of starts with like showing up for other people and like not even thinking about it like yourself. Like for me, I'm like, all right, this is going to be another journey or another day. And even though I just dealt with this morning and I'm going through this right now, even if I'm going to the grocery store, I'm going to be the first one to smile at someone who walks by because I'm putting out positivity and I'm just hoping that that comes back to me. So for me, like, especially when I'm feeling like I'm like lacking something like hope or positivity, I like think in my head, like put that out there. So then that's what you get in return. And I know it's so hippie like to think like that, but that's how I get through my life. And I feel like it sets me up for like a positive mindset every day and through some of the biggest struggles I've ever had in my life.
Awesome. Des, there was another question in the chat. You guys have some, again, amazing questions, and I think they're more geared towards Dr. Dry and Melissa, but Crystal is very active. She's getting involved with running. She's really working on her fitness after R&Y, and she's really worried about her recovery time and losing all the fitness that she's worked so hard for. And you can kind of speak to this because you were busting your butt to get fit before your plastic surgery, and then you had plastic surgery. So what insights could you offer Crystal?
I will say that don't worry, not all of your efforts are going to go to waste from recovery. It's just a little time out of the gym and it's going to be worth it. And you've already shown yourself that you've done it before. You can absolutely do it again. And it might even be easier this time. And also, like, once you get your new gym clothes with that new tummy tuck, you're going to be so excited to get to the gym and you're going to be working out harder than ever. I speak from experience. So be excited. But yeah, I ended up getting, because I had my tummy tuck, and while I was in recovery from my tummy tuck, like 4 or 5 weeks, I was like, wait, as I'm in recovery, I think I want to get my boobs done. And it was kind of spontaneous, so unlike me. And I was like, okay, I'm just going to start going to some consultations. I was in my full body garment with drains, seeing boob job plastic surgeons in Beverly Hills, like, hey, drains and all, I'm here. I just want to see what's up. So they were like, yeah, like give it like a month and a half to 2 months. That's the soonest we'll work on you. And then of course I had an allergic reaction to the implants, and that's supposed to be a really quick and speedy recovery. And it ended up being about 4 or 5 months. So I was out of the gym for like 5.5, almost 6 months, only because of my crazy allergic reaction. It's all on my YouTube. If anyone here has no idea what I'm talking about, go watch it because it was kind of crazy, but we're all good. We're all good. There's a light at the end of the tunnel, always is, right?
And it really sounds like the effort that you put in did help to your recovery, and you were already in that mindset. So when you had a body that more looked like the one that you were looking for, you're a little bit more motivated to continue your fitness journey. I mean, it just kind of snowballed for you.
April, literally the week that I was cleared to start working out again after my boobs, like I think I was in the gym for 2 weeks, and then I went to Nebraska and made my workout program with Maddie because I was like, oh, we need a workout program. I was excited. I was like so ready.
Dang.
So you'll get back into it. I did, and now I'm leaner and I have more muscle than I ever did before my tummy tuck. That's just the pregame.
You are amazing, my friend. Des, if you can stick around for a little bit afterwards, I'm sure people will have more specific questions for you. So if you have a couple minutes, they would love that.
I got you.
Thank you, girl. In the chat, Jason, will you mind make me host again? I made you host because my internet was going really unstable. Before we transition to Dr. Dry, this is the teacher and me coming out. Will you take 10 seconds, 15 seconds, reflect on what you heard from Des. And if you feel like sharing in the chat what you're kind of taking away from her part of today, we would love to know what you are taking away. It's important to kind of give ourselves a little bit of a, especially with Des, because she throws so much at you so quickly and she's so much energy. You're like, I don't even understand what just happened to me. But
guys, I know, I'm so sorry. I know I'm a lot.
It's nothing to apologize. It's something to be very proud of, Des. I don't know how many times I have to tell you this.
No, that's what I'm saying. Like, I want to make sure that I like, because I know sometimes I go on these rants, right? And I'm saying a lot and it's probably sparking a lot of questions, and then people forget their questions and I probably forgot the track I was on. So I will definitely stay back and answer questions later for anyone that I missed, or just, I don't know, if I missed anything, just tell me and I'll try not to talk your ear off, but get your question answered.
Girl, it's all well, and Des is here. So if you have a question for Des, maybe write it in the chat and then Des can read it and respond by typing, if you guys would like to do that as well.
Oh yeah, I'll type back. Yeah, that's fine.
Boom. Thank you, friend. So I found this awesome quote from Freddie Wilcox, and although it is not related to what we're going through, it kind of is. And it says, progress always involves risks. You can't steal second base and keep your foot on first. That hit home for me. I don't know if it's hitting home for you guys as well, but this entire bariatric journey is a risk, right? We are leaving sight of the shore. We are letting the ship go. We are stealing second, and we have to take our foot off first. So not only we're doing that when it comes to our bariatric journey, but we also have to do it if we're thinking about plastic surgery as well. So just something to kind of keep in mind. All right, Mr. and Mrs. Dry, welcome.
Thank you.
Thanks for having us.
Yeah, happy to be here. And thanks for having us on.
We are so excited. So Dr. Dry, you alluded to, you have a different connection with the bariatric community. Will you kind of start us off with that?
Yeah, no, happy to. And I would just sort of say, like I said before, I mean, I'm plastic surgeon, been doing it for 20 years. And there's a certain part of the weight loss community, the bariatric community, that is very special for me and also incredibly unique. I mean, the bariatric surgery, the weight loss community are probably one of the most motivated, determined, dedicated individuals you'll ever see. There's no question about it. And in medicine in general, we don't get that on a constant basis. I mean, mostly we deal with people who with, I would say, sort of self-induced issues that we're trying to fix. The bariatric individual, the weight loss individual, has done something so incredibly proactively positive in their life to be able to say, I'm going to be healthier. I'm going to be here for my friends, for my family, for my loved ones, and I'm going to do whatever I need to do in order to be able to lose the weight to continue on being happy and healthy. And then that is an amazing thing that you yourself do for you, and you yourself do for your friends and your family, for other people, which is an amazing thing, which for being a part of that along that journey from a plastic surgery perspective is an amazing thing. I mean, we're happy to be there for the few hours that we are there during the surgery or during afterwards, but we can only be there because you guys have done what you've done. And that's it. I mean, you've done the amazing job of being positive, being proactive and healthy in your life. And then we're a part of that journey. So it's amazing to be part of that journey. It's an honor to be part of that journey for so many of these things. And it is, again, congratulations to anybody who enters into that, to be able to say, today I'm going to change my life, and today I'm going to be better for the rest of my life. And it's an amazing thing. So I congratulate anybody who does that. It's a phenomenal thing. So, and it's something we don't usually deal with in medicine.
Everybody raise your water glass or your protein water or your protein shake to Dr. Dry for acknowledging what we doing to live our best lives, my friends. Thank you.
And it's anybody sitting there, it's sort of one of these to yourself, there you go.
Just
yeah.
Brush it off, brush your shoulder off.
It is. And it's sort of one of those things that, I relate to. And this is why sort of, I love being part of the positive attitude, positive motion. And Des exemplifies that to the nth degree, which is fantastic. And I love the Katy Perry hair and the sparkly background that she's got going on. It's all one and the same. It's beautiful.
It is the whole package. It is the whole package. I promise you that.
Oh, I know.
So sweet. Thank you.
And it's sort of, so for my personal background, and I won't belabor this or bore this, but certainly I was 12 pounds when I was born. I mean, I was, when I was 10 years old or so, I was about 180 pounds, size 36, 38 waist. I went to a boarding school. I always had to wear these little uniforms, and every time I bent over, I split my pants open. I was always one of these big kids that wanted to be normal. I just looked at my friends and everybody else, and I want to be normal. And it's that mentality, right? That mentality that basically sticks with you for the rest of your life. Unfortunately, in my early 20s, I lost close to 100 pounds. So, I mean, I understand and relate to the psychology and the mentality about going through the weight loss. And again, applaud anybody who can do it and anybody who can continue on doing it. And I think it's an amazing thing. So I certainly love it. I love being part of it. And for many years, it's been a huge part of my practice because, again, it's my people. I mean, I understand it and I can relate to it.
Well, when we interviewed Veronica for the podcast that we just released on her plastic surgery experience, we really kind of talked about how important it is to find somebody that specializes or understands the bariatric patient, because we are different in a lot of different ways. So can you kind of speak to why it is important to really kind of do your research and seek out professionals that understand that?
Yeah, and that's an important thing. And I mean, I think that sort of is anything that you do along the lines of medicine. Obviously, seek out people who are experienced and specialize in that in particular field. And then with specific reference to plastic surgery and the bariatric or the weight loss individuals, what we do surgically and technically is different for the weight loss individual than the non-weight loss individual. So a standard tummy tuck in a non-weight loss individual is different than a tummy tuck that we do in a weight loss individual. And it all has to do with redistribution of the extra skin. And it's sort of a technical aspect. So you have to be knowledgeable and experienced in terms of the actual sort of the way that the skin falls, the way that the excess skin is, because there are certain technical differences that we need to do in order to the weight loss person as opposed to the non-weight loss individual. And I think, yeah, I mean, it's very key that you find somebody who just has that experience. And again, there are plenty of surgeons around who enjoy being part of it. But I think you need to find somebody who's had experience doing it.
Absolutely.
Yeah.
So there are lots of questions in the chat about like, when is the best time to undergo plastic surgeries, right? Some of us here are waiting maybe until after kids, or do we need to wait, or how far out from surgery should we wait? What's kind of your timeline for that?
So as a general rule, when your weight is stable, so, and however long that is after the surgery, if you're having a VSG or a Roux-en-Y or anything like that, just make sure that your weight is stable. And you're going to go through, as everybody knows, you're going to go through various plateaus, and you'll drop the weight, you'll plateau for a little bit, and then you go a little bit more and plateau a little bit. So when your weight is stable, and ideally you probably want to wait around 6 months. So a minimum of 6 months with really minimal change in your weight. And I mean, within sort of 5 to 10 pounds. You don't want to have a 20, 30 pound weight fluctuation and then undergo surgery. So weight stable, plateau, getting to that point for at least 6 months. And I know everybody wants to jump on the bandwagon. Everybody wants to get things done super, super quick, but just sort of, as Des aptly put it, chill out for a little while and just basically plateau. Make sure that your weight is stable, because again, if you're going to invest so much time and energy into doing it, you want to make sure that you're going to get the optimal outcome. And to the question you said in terms of pregnancy and kids, it's a great one. It's a tough one. I usually advocate you want to wait until you're done having kids in order to be able to do some, significant procedures, especially as it relates to the trunk, meaning the abdomen or the back or the butt, and indeed breasts. I mean, other things that you can do, such as arms or even sometimes neck or face, you can probably do that in the process before you've finished having kids. But the other bigger procedures is probably wait till you've done having kids.
Veronica, I don't know if you feel comfortable sharing this, and I definitely don't want to put you on the spot. I don't know if it was a personal conversation or the podcast, but when you first met with Dr. Dry and Melissa, they really basically said, we won't do this on you until you have done exactly what he said. So will you kind of speak to like how COVID also threw you off a little bit in there too. So how did you know that like, I'm ready, I'm stable, I'm good to go?
So I went in for the consultation first and, asked a lot of questions of like, do I have more weight to lose? What does this look like? And, I think I probably still had another 10 to 15 pounds. So I still waited. I waited about 6 or 7 more months before I even booked the procedure. And, like they were saying, you want to lose as much weight as possible. You want to maintain. And I had maintained my weight for probably a good almost 6 months before I was going in for the procedure. And then due to COVID, it got pushed back. And, I had that concern of, oh my gosh, like, what's going to happen? We're not moving. We're not going anywhere. I'm not going into work. Like, what's going to happen? And so I proactively hired a nutritionist for, the 3-4 additional months that I had to wait, just to ensure that I wasn't going to gain any of the weight back, and to get down to as much weight as I could. Like, I wanted to take as much skin as possible from me. Like, so you got to be proactive. You've got to do your research, and you've got to really want to do it, right? Like, this is a commitment. And if you're going to commit to it, you want to be at the lowest weight you can in order for it to be successful. So I definitely, waited and then made sure I didn't gain anything.
Well, and this, oh my gosh, this conversation is so powerful because Veronica, you are a very active person. Des, you are like bodybuilder of the year now, but you both did what you felt comfortable doing before your surgeries to best prepare. I mean, Veronica, you hired a nutritionist and you got to your lowest weight through eating and light movement. Des, you got to your low weight through macros and hardcore movement, but you
Yes.
both had very successful procedures. You both set yourself up for the ultimate success afterwards, and you were armed with all of this knowledge that came from your surgeons. It's just same result, you just went about it different ways, which is, I think, really powerful for people that are not hardcore bodybuilders, right? They're just, I like to play golf and go for walks. That works too, right? Like you can do it both ways.
And I kept the nutritionist for an additional 8 months afterwards. I just figured this is going to be the best for me. And it was successful, and no regrets at all.
So Dr. Dry, I have a question for you, and I'm not going to spoil some like interesting things that came out in our podcast today, Des. I think you know what I'm going to ask, but
I know.
Okay. What does it mean to be a board certified plastic surgeon? And why is it important to find a board certified plastic surgeon?
Yeah, great. That's a great question. So board certified in anything is basically somebody who is certified by the American Board of Medical Specialties. And there are certain recognized medical specialties, plastic surgery being one, orthopedic surgery being one, neurological surgery. There's a number of medical specialties that are recognized by that. And if you are a board certified plastic surgeon, or indeed a board eligible plastic surgeon, it means that you have completed an accredited training surgery in plastic surgery specifically. So not ear, nose, and throat, not dentistry, nothing else like that. So it's an accredited program in plastic surgery. And then you are certified by the American Board of Plastic Surgeons as a plastic surgeon. And I think it's a great question. And I mean, I think it's very important for people to seek out those surgeons who are either board certified or board eligible in plastic surgery in order to be able to do their procedure. In a similar tone, I would say, if you need your knee replaced, I would seek out a board certified orthopedic surgeon, not a dermatologist. So I think it's very important to have that in your criteria in terms of where you search and where you go for.
Okay, right. Because so what you're saying is that, they're all doctors, but one specializes in something that you want them to be very specific in what they are very good at doing. And if you don't have that, then sure, you're getting a doctor, but okay.
Yeah, that's correct. I mean, you want them to be trained in the surgery that you're going to have.
Okay.
So that's sort of at the very basic level. Yeah, board certified, board eligible plastic surgeon. And then, from a patient perspective, I mean, their experience dealing with a bariatric and the weight loss individual. How many procedures they've done. I mean, obviously representative pre and post-operative photographs. Do they understand the process? And that's just simple conversation that you can have with your surgeon, whoever it may be, in terms of their experience dealing with the massive weight loss individual.
And I would imagine too, as a patient, we have the rights to ask for references, right? And of course, you're only going to recommend that people talk to ones that have gone very well. But I would assume that, it's almost a good idea to say well, here's a bunch of people that I worked on, contact whoever you'd like and have that conversation, or see the results maybe that they post on their own social media, not the ones that you post, because that might be a little bit different, right? We talked about that today, Des, in the podcast. What the surgeon wants you to see might not be what actually ended up happening, right?
Yeah, the surgeons like to hit the highlight reel, as we call it. They like to hit
Yes.
losses. They look there's some losses in there.
Yeah, there's not many surgeons who will post the bad outcomes, that's for sure. But and it gets to your question, April, about where do you find your research? How do you do your research? What's the best sources in order to be able to get that? Right. And I think one of them is exactly what you guys do here. I mean, in terms of being able to sort of connect with other people and other like-minded individuals, other people who have gone through similar situations, and what has been their experience. And I think the best sort of referral research source is other people who've gone through it, friends, family members, other people you find on Instagram, some other form of source, support groups, great places like this that people can share their experiences and share what they've gone through in their surgeons. Now, I will say, you mentioned about, asking physicians or asking surgeons for their patients. I mean, by HIPAA, by law, we can't disclose that. Yeah. So we can't give you a list of patients. However, if you go to whatever Instagram or anything like that is going to be beneficial. And there are some physicians who will have already asked some patients to share their experiences with other patients, and that's fine. You can do that. And that's a great way to do it in order to be able to get it straight from people who have gone through the process.
Okay, so like testimonials, if you will, kind of, right?
Yeah.
These are people who've said, I give you my permission to share expertise.
Correct. Yeah,
Okay.
you got it. Yeah.
Okay.
Now,
So-
one other thing, Dr. Dry, we actually talked about earlier, and we've heard it before too. There's terms different people saying plastic surgeons are better for bariatric patients if they're more bariatric focused in their surgical practice. Is that something that you recommend over just is there anything different between the two as far as what you guys know, what you learn, and kind of the approach you take for the surgeries for people?
Yeah, I mean, it's a good question. It sort of goes back to experience. I mean, experience of that individual surgeon in order to be able to deal with that particular surgery. And I would say that there are certain surgeries sort of in the weight loss area that are more important to have an experienced surgeon. Things to do with the trunk, sort of whether or not it's, a 360 or a tummy tuck, medial thigh lifts, brachioplasties. I think those things are sort of much more amenable for somebody who is more experienced in it. Certain breast procedures can be done by a variety of plastic surgeons, and they don't have to be specifically bariatric or weight loss experienced individuals. But I think, again, it goes back to, dealing with the experience of the surgeon. And I think every patient should ask their surgeon, I mean, how many of these have you done? What is your experience with it? What do you do? Because it's not just necessarily the technical aspects of the surgery, which are incredibly important, but it's also, this is a long journey. I mean, this is not just simply you come in, have a surgery, and then you're done and gone. It's quite a significant amount of follow up afterwards, making sure that everything is going along according to plan, making sure that everything is as smooth as it possibly can be, and that requires a lot of follow up and a lot of interaction. So it's not necessarily can you technically do the procedure, but what is the experience during the follow up as well, and being there on a constant basis for the patient.
Wow. Well, yeah, and just based on, our personal conversations with Veronica and Des, that is absolutely true. It is a very long journey. It is not something that you just snap back from. It's a lifelong commitment. And, it's one thing to really want this certain type of body, but it's another thing to actually get it, right? So knowing what the actual price is going to be going into it is, I think, key to probably long-term success.
Yeah, and it's an important, having a realistic expectation. As Des mentioned, I mean, this is not perfection. And I would love to be able to say that we can create perfect, but it's being able to create the best we possibly can out of the current situation. And it's optimizing what we can, and it's setting out a realistic expectation in terms of what is possible. And there's sometimes a difference between what is wanted and what is possible and what is actually achievable. And again, I mean, that's a good discussion to have. Obviously, make sure the surgeon can understand what is realistic and convey that in a sort of a good manner to the individual going through it, but it's going to be an expected outcome. So it's important to have realistic expectations.
Excellent. So where do you suggest people start then? So what if they are ready to go ahead and try something out? Where do you recommend they begin?
Well, I mean, so one of the things obviously is, as I mentioned, great groups such as yourself, reaching out to, places like this, support groups like this, to be able to find out what have other people done? Where have other people gone through? Because obviously you're getting experience that way. Obviously, social media is another great way to go, because obviously you're not necessarily getting the specific filtered, doctored photos afterwards, and you're getting the experience right from the individuals. You can go to the American Board of Plastic Surgery and the American Society of Plastic Surgery to look on their site to see who does and who specializes in bariatric surgery as well. And obviously look in the local areas to see what physicians and what surgeons, again, specialize or do a lot with them. But I would say that the best referral source that you can potentially get is somebody who's already gone through the experience, gone through the process, and what was it like. And then, and again, I would echo the sentiments that have been said before in terms of going and seeing a number of plastic surgeons. Now, my usual recommendation is 3, simply because if you see 9, you're going to get really confused. And I mean, then you're going to go, who's right, who's wrong? I don't know. And so I usually recommend, seeing 3. Again, if you want to see more, that's, your prerogative, but, the confusion factor really gets in there. So 3 at least, and I think it's good to choose those individuals in order to be able to sort of see what they say. And again, it's a comfort level that you have with their experience, their knowledge, and being able to, take care of you, the individual, going through the entire process. So at least 3. And getting back to another point, in terms of all of these other procedures, don't do anything unless it bugs you. just because we can doesn't mean we should. So all of this stuff here, yeah, I mean, if it bothers you, great, address it. But if it doesn't bother you, leave it alone.
Oh, that is very powerful advice, especially considering kind of what Des went through. And I think we so appreciate that, hearing it from you, just recognizing the work that it takes to lose the weight, recognizing the struggle that we've maybe had with our bodies our entire life. And then, kind of coming to you and having you poke around areas that we maybe don't want anybody else to touch, and giving you a very intimate look of what's going on, for you to just say, it's okay, let's educate, let's focus on this. And I think finding and connecting with a plastic surgeon and their staff that really honors you as a person and honors your journey is just as important as them being skilled and knowledgeable and helping really be the teacher for you, right? Like, we need somebody to teach us about this. We don't speak this language.
Right. Yeah. And it's incumbent upon us as surgeons and physicians to be able to educate the individual coming to us to the best of our ability in terms of what we can do, what is possible. And again, being a part of that journey, again, is an amazing thing, because it's not just simply that surgery. It's the journey started years ago. And I mean, being a part of that, recognizing that, is an amazing honor for us to be a part of it, for sure.
Dr. Dry, Melissa, we are quickly running out of time. This always happens. But if you have a few extra moments to stay after, we would very much appreciate that. But I do want to respect and honor everybody's time. I think I speak for everyone. We say this has been flippin' amazing. Every time we connect, we learn so much, and we're so thankful to get to know you, our experts, as real humans who have been through what we're going through or have empathy for what we're going through. So we very much appreciate your time. Thank you to our amazing guests. To wrap up, you guys, as always, again, this is the teacher in me coming out. We want to make sure that you are leaving today with what you were hoping you would get out of it. So if you wouldn't mind, in the chat, you guys, just let us know, are you leaving with something new and valuable today? And are there any takeaways that you are excited about? And I very much appreciate you guys. I see in the chat, you guys put the American Society of Bariatric Plastic Surgeons in there. There's a link right there, so you can go ahead and start your own research there in a place that you know is valid and credible. Yeah, and if you'd like to unmute yourself, you're welcome to do so too, if you'd like to say anything.
Dr. Dry, I have a question.
Yes.
So there is a Facebook group called Weight Loss, like plastic surgery after weight loss, and that's a very helpful group to join if you're considering plastics. But there's also a wound care group, and I had asked this on the East to West Instagram page. Why does it seem, from this group, this wound care group, that many of the plastic surgeons are hesitant to refer to wound care until things are really, really bad, like where patients have like gaping holes, and it's a common complaint on there.
Yeah, it's a good question. So one would hope that obviously, the wound care clinic and the wound care community not be engaged a tremendous amount in situations like this, but obviously they can, because this is surgery and certain things can occur. I would say for the vast majority of circumstances, although not all, the wound care clinics and the wound care community is sort of probably not necessary for the small little wounds that do occur, and they can be probably best managed, usually by the individual surgeon with local wound care. Now, you're right. If you have a large complication and a big wound, that is probably best managed at a wound care clinic. But again, the vast majority of wounds that can happen, although it's not very common, are easily and most consistently managed just sort of by the individual surgeon. But it's a valid question, and I would hope that the individual surgeon would take care, prudence, and make a good medical decision in terms of the necessity for having that referral to a wound care clinic if need be.
Excellent question. Thank you for asking that. I'm seeing really great stuff in the chat, you guys. We're so thankful for your attendance. We're thankful that you are part of this community, and we're thankful for your willingness to kind of get a little bit uncomfortable and click on a random Zoom link and join a bunch of people and hope that it's a safe place. We know how scary that can be, but you guys did it. You are amazing human beings. And we always say this, but all of the people who engage and come and really want to be a part of the community, you are the best part of the community. You are why this community is so flippin' amazing. If you guys would like to support East to West in a different way, here's 4 ways that you can do so. You can like our content, you can share our content, you can keep coming to all these awesome live events here and on Instagram, or you can become a patron of East to West. All of those ways support us and help our community grow. And it ensures that this type of support stays in our community and stays accessible for everyone. So if you guys share these posts, share the right, all that helps us grow. So we very much appreciate that. And if you would like to become a patron, you can visit our Patreon page at patreon.com/East2WestWLS. And so many of our patrons are here tonight. You guys know how much we love you. Thank you. Thank you for that. Our very last part is looking ahead. Our August support topic is fun in the sun. We're going to talk about how we can kind of decenter food, how we can put other fun things ahead of all of that, how we can have fun with our friends and family after bariatric surgery. And of course, we will be sharing some amazing bariatric friendly recipes and some drink recipes as well, if that is your thing. So our next VBM will be August 11th at 5 p.m. Pacific, and that is a Wednesday. We're switching it up a little bit for August. So it's already on the website. If you'd like to register, you can go ahead and click that link, register now, and we hope to see you. We hope to see you there.
Absolutely.
All right, that officially ends this part. The experts are going to remain on if you guys do have questions. But again, thank you so very much for coming. You're welcome to say goodbye. And if you have any feedback for us, we would love to hear that. You can direct message us on Instagram. Okay, I think I did it all. Oh, thank you guys so much for hanging tough with us. If you have any questions, let's try to roll through them very quickly so we can get through as many as we have, if that makes sense. How about this? Do you guys know how to raise your hand digitally?
Oh,
No? Yes, no? I don't want to get to the point where everybody's unmuting and asking a question at once, but maybe we can give it a try. If you have a question, unmute yourself and ask away. And maybe make sure you say who your question is for. How about that? Okay, I know y'all have questions.
I have a quick question for Dr. Dry. In what circumstances would you perform a lower body lift versus an upper body lift? I've seen kind of both, and I wonder how you make that determination, or kind of what body type is best for which. Oh, I think you're muted.
Yeah. All right, that's an easy answer. Upper body lift generally being sort of, arms, breasts, and maybe bra roll or sort of extra skin in the back. Lower body lift being abdomen, back, thighs. The short answer is whatever bugs you the most. Start whatever place that bothers you the most. If the arms and the breast bother you the most, start there. If the lower body, the abdomen bugs you the most, start there. It's up to you. We're happy to help. Just start wherever bugs you the most.
That is such
I also have a question. Oh,
yeah.
Sorry, I thought I didn't interrupt you. Okay, Dr. Dry, question for you. So this is kind of like a weird question, but I'm just genuinely curious. So is it possible to do like, I guess a thigh lift is I don't know what the technical term is for it, but to do like a partial thigh lift where like you don't go all the way down to the knee, where you're just focusing on like the upper thighs? Does that make sense?
Yeah. And basically a thigh lift needs to go as far as you have extra skin. If you don't have extra skin that goes down to the knee, then you don't need it all the way down to the knee. Right. So if you just have it in the upper part of your thigh, then that's all that it needs to be. Yeah.
Cool. Okay. I just didn't know how customizable it was. So good to know. Thank you.
Hot damn, that's good news for me because I'm only a hot mess like 5 or 6 inches down. So oh, Veronica, go for it, Fred. Oh, you too? You're only hot mess 5 or 6 inches down?
Yes.
We are blessed in that way. Mm-hmm. What other questions do you guys have? Now is an excellent time to ask them. Yeah, Karen. Hi,
I have a question. One of the things that you have said, Dr. Dry, that really piqued me, and I think is my biggest takeaway, is that you said, address what bugs you. And what I would think for myself that's always bugged me, even though I've got loose skin everywhere and I'm not, but it would be my arms. I mean, before even. So yeah, that I've
Yeah.
been flying for a long decade. So that would be, I mean, I think, I could mask tummy. Even though I would like to do that, but if I was just going to do one thing, what you said when you said what bugs you the most, that would be it. So I think you have helped me to direct how I'm going to be going. Now, if I do that, would I still need to wait until would I still need to wait if it's the arm? Would I still need to wait the 6 months after I am settled?
Yeah, I mean, you want to wait for at least 6 months, because I mean, weight loss is going to occur all over the body. We don't get to spot weight loss. I mean, we don't get to say, I want it here gone or in the arms gone. It's a general body thing. So if you continue to lose more weight, you're going to continue to lose more fat in the arms. You're going to continue to generate more loose skin. And then once you've stabilized them, we can take out the maximum amount of extra skin that you have. So anywhere on the body, it's preferable to stay that 6 months in terms of that stability of weight. And back to your point, I mean, I encourage people to say, if in your mind, if there was only one surgery that I could do, that's it. I don't get any more, what would it be? And that's going to sort of take that to the highest priority. I mean, everybody wants everything, that's fine. But just if you had in your mind just one, what would it be? And then start with that.
And what makes that so powerful is that again, this is your journey, this is your story, this is your body, right? Maybe your love handles don't bother you as much, but those bat wings just drive you to insanity every single day. You have the power to kind of make the decision that's best for you and not, for anybody else. And to be armed with some basic information when you go on to meet with your surgeons. If you're getting somebody pushy who is not like Dr. Dry, then you can be like, well, this has been fun. See you never, right? But now you like, oh, I know exactly what I need to ask. I know what's important to me. This is what I'm looking for. You are the consumer. You are making those choices informed. So it's a really powerful place to come from. Absolutely.
Yep.
I have a question for Des. Oh, sorry. This is hard.
How about we do Jackie, then we do Katie?
Okay, sorry about that. I have a question for Dr. Dry. I have had 3 previous C-sections. And so I'm kind of wondering, and I know that at this point, I'm only 4 months out from RMY. And so I know at this point that I'm going to have that excess of skin in the front. Where, like with a tummy tuck or the apron procedure, where does that scar go? Or will it be below my C-section scar? Will it be my C-section scar? Because that thing has keloided already, and we're looking at like the third C-section.
Yeah, it's a good question, and it's a common question. And of course, we see people on a constant basis with C-sections. So the general answer is you'll make the new scar below the C-section. So you'll take out all of the C-section scars. Because we don't want to go through the existing C-section. You go below it and then basically remove it. So you have a brand new one. So just one long one other than C-section.
And does that take away the belly button?
No, it shouldn't take away so one of the things, in terms of overall procedures that we can do, sort of just looking at the front in terms of the stomach area, the abdomen area, there's things like paniculectomy, and then there's sort of tummy tuck, and then you can get into the fleur-de-lis, or then the 360. A traditional paniculectomy basically takes out the overhanging skin below the belly button. Now, a traditional paniculectomy does remove the belly button. However, it's not very commonly done anymore, because the belly button is a very unique feature of the human body, and its absence is very noticeable. Everybody has different shaped belly buttons, and that's okay, but its absence is very noticeable. So I would recommend anytime you go in and see anybody, the preservation of the belly button, if it's important to you, is something you should discuss with your surgeon and say, yes, you can remove that extra skin, but can you make sure that you keep the belly button? And I would say almost always that's done.
Awesome. Thank you.
Perfect question. Miss Katie, you have a question for Des?
I do have a question for Des. Des, my girl.
My
Okay, so I'm just curious, after going through everything that you've gone through and knowing what you know now, is there anything that you would have done differently or things that you wish you would have known before having your plastics?
Ooh, loaded question.
Sorry.
No, I love it. Okay, well, like there honestly was a whole conversation about this on the podcast earlier that we recorded, and like we're saving the juiciest part of it for like
I was gonna say,
Spoilers,
don't give it away.
But totally, yeah, there was like a really big question that I should have asked that I didn't, and I found out like a month after my procedure. This crazy. You'll hear it. You'll hear it on Wednesday. But yeah, it was
okay.
crazy.
That was my next question. When is the podcast coming out? When do I need to be
on Wednesday?
Prepared? Okay,
It's coming out Wednesday.
Got
Maybe
it. I can wait till I just text me. I can wait till Wednesday. It's
fine. But yeah, no. There's like definitely like it's always a learning experience, and I can spend so many hours and have so many conversations asking questions, but you'll still never go into anything knowing everything. Like there will always be surprises, right? But yeah, like that was like what we talked about in the podcast is the main thing. But just like another thing, like for me was just like I really wanted to be ready to go to the gym ASAP. And I think what I didn't realize was just how long like I would be swollen. And I think like if I would have been mentally prepared to be swollen for 6 months, because I was like, dude, I got a tummy tuck. Like, why am I still like, I don't look like it. Like low key, like I don't look like it. Like not to sound like hard on myself, but like I had a different expectation. If I would have been more mentally prepared to know that swelling could be up to like 6 months even. They're like, oh, like 4 to 6 months usually. But mine was definitely on the longer end because like looking at pictures, I'm like, wow, I was still swollen there. And I totally didn't think I was at the time. But like at 4 or 5 months, I was like, I thought this would be done with, So if I would have been mentally prepared, then I wouldn't have been so like antsy and like I've been like, time will pass.
Yeah. So the healing part takes time. In other words, like it takes a lot of time. Okay.
Like I just wanted to do core exercises, but I was like, no, don't go too crazy, Des. Don't go too crazy.
Not a good idea.
No, let's cool it down, tone it down. I have a hard time with that.
Yeah, I know you do. I should drink some energy drink.
Happy 6 p.m.
Oh my goodness. All right, you guys, are there any more questions for our experts? They are volunteering their time with us, but I want to make sure we get in as many as we can and respect everybody's time before we say our goodbyes.
I see a question on the chat.
Anybody?
Oh, who did I cut off?
No, I see a question on the other. It says tummy tuck, something about tummy tucks.
Yes. How do I know, from Anna, thank you, Anna. How do I know what tummy tuck is good for me? A mini tuck or an extended tummy tuck?
Yeah, that's good because I couldn't see that. So my wife pointed it out to me because,
Thank you, Melissa.
A little far away from me, so too much information there. So, how do you know? I mean, that's a great question. And I would say, again, as a general rule, I mean, if you've lost 75 pounds or more, you've got a lot of loose skin, and that loose skin is in the front, it's on the side, it basically goes all the way around onto the side. So anybody who's lost about 75 pounds or more as a general rule would aesthetically benefit from a 360 tummy tuck. So going all the way around. Very, very rarely is anybody a good candidate for mini tummy tuck. So mini tummy tuck basically is a small little incision just right above the pubic area, and we'll take off just a little bit of skin and pull it down. And again, in the weight loss community, that's almost non-existent because you've got a lot of loose skin that goes all the way around. You can do a standard tummy tuck if you have a moderate amount of loose skin that's basically just in the front. If you have moderate amount of loose skin that's in the front, you can certainly do a tummy tuck and then contour on the sides with some liposuction on the sides. But again, I caution people, I mean, if you do have loose skin a lot on the side here and some on the back, then generally it's preferable to sometimes go all the way around. Yeah.
So that would be more like the apron that people talk about, just the loose hanging apron that goes in the front.
Yep, you got it. Exactly. That's that apron that's on the front. And it's not uncommon. And you can certainly just remove that extra loose apron that's on the front for sure.
Awesome. Oh yeah. So and Veronica, you had the 360. Des, you wish you had the 360. Oh, okay. And Veronica, you've been super happy with your, I mean, I've seen you shared with me very intimate before and after photos. And I was like, who is this body and this woman? Where did my friend, what the hell? Oh, hell no.
I think we actually shared them on your podcast.
Oh, we might have. Okay.
Yeah.
Okay.
Yeah. I was still swollen. Just so you guys know, in the after picture, I was still swollen.
Because I have seen pictures of you in like Lake Havasu 2 months ago, and I was like, this bee, you have got to be kidding me. I mean, oh my God. Literally, when I saw those pictures, I was like, well, I guess I'm having plastic surgery now. I'm just gonna,
there you go.
I'm just going to follow in your footsteps.
I can recommend a really good surgeon.
Can you? Oh.
And we can only do it because you guys have done what you do. That's it.
There you go.
Veronica, do you regret your surgeries at all? I mean, not to like throw you under the bus surgeon here.
Nope.
Wheels are
No
off.
regrets. Honestly, like I've never had kids, don't plan on having kids, but no matter what you go through, the end result, I hear that when you have kids, you forget about all the pain, blah, blah, blah. Same thing. Like, recovery's hard and it's difficult, right? But you're at this point where you're happy with your body. Like, you think I ever would have sported a bikini before? Not because I couldn't, it wasn't comfortable. And now I think I have like 75 swimsuits and I have a serious problem, and it happens. And the one thing I think people need to realize is, like, with the weight loss surgery and any plastic surgery, it's just a tool to get you where you want to be. You still have to do the work. Like, it's not easy. Maintenance isn't hard after the weight loss surgery. Maintenance isn't easy after the plastic surgery. So you just have to remember, it's, you're not going to come out of it looking, the expectation is there, right? And I'm absolutely thrilled with my results and couldn't be happier. But it's hard work. It is hard work, and it's not easy, and every day is a struggle, and people just have to realize that.
And I also got the 360, and it did wonders for my thighs, because that's what really bothered me. It really lifted, not my inner thighs, but the front of my thighs, the side, the back. And I used to have a really big butt, so I think that's maybe why my surgeon didn't recommend a BBL with it. But I hope my butt fluffs out, because I feel like it's really flat now. So
it'll fluff up. You'll be good.
It does get better.
Yeah.
Thank you.
And I really appreciate Veronica and Des. We've had this conversation personally and publicly, but the whole point of bariatric surgery is that we're choosing our hard, right? Before surgery, we were choosing a different type of hard. And now that we've had surgery, you kind of have to come to this realization of, oh, life is still hard. But now I'm just choosing a hard that is adding to my life instead of choosing a hard that's kind of taking away from it. And it doesn't matter where you are on the process, pre-bariatric, post, pre-plastic, post-plastic, you are still choosing into that hard every day. There is no escaping that. That is just a qualifier for life. And it's just getting your brain wrapped around that shit that can take some time. And it's not easy. You have to choice into it every single day. Every day.
It's an everyday decision.
Right? I mean, Des, when you told us on the podcast that there are some days that you don't want to work out, I was like, I'm sorry, what? You have got to be kidding me. But
it happens. Whoa.
Oh my goodness, you guys. All right. I hate to say it, but we do have to wrap this up. Once again, I want to thank our experts, our guests. Veronica, I'm so thankful that you were here to also share your experiences. It just means the world to us, and your support means that we can continue to grow in our understanding of our own journey. So I think I echo everybody's sentiment who said, thank you. This was amazing in the chat. We very much appreciate you guys.
Absolutely.
Awesome.
Dr. Dry, Dr. Dry, Melissa, Veronica, Des, and Katie, will you guys stick around? Everybody else, we thank you so very much for coming, and hopefully we'll see you at our next virtual bariatric meetup in August. Bye, guys.
Bye.
Bye, guys.
Yeah.
Jason, will you stop recording, or do you want to make me host again?
Yeah, because my connection's about as bad as yours is right now. I guess we've got.
Oh, Donna, dang it. Donna had a really great question. Is Donna still here? Oh, does age impact recovery time?
I don't know.
I can pass that question on.
Yeah, it does to a certain extent. It does, because there's two aspects in terms of age and recovery. I always talk about sort of there's the emotional aspect of recovery that you guys sort of touched about, and then there's the physical aspect of recovery. And I would say that the physical aspect of recovery in terms of how quickly you bounce back from a surgery, yes, obviously, I think that the younger you are, the quicker you're going to respond. Now, there's the emotional part of it and the mental aspect of it. And I've always contended and I've always believed actually the older you are, the quicker that you will mentally and emotionally respond to the surgery and the quicker you'll get over it. And that's simply a matter of perspective. Because I think that every single situation and every event that anybody, it occurs in life, if it's good or if it's bad is dependent upon our perspective on it. And we can label this a good event, a bad event, but it really depends upon what we impose on that event. And if we label it good or bad, then that's up to us, but that's how we're going to perceive it. And I think that the older you are, you've had more life, you've had more perspective in life, you've gone through more things. And I think based upon that, if you have a surgical procedure, some sort of weight loss procedure, some sort of plastic surgery procedure, you understand that this is not a fun event. This is not great. It's, it's uncomfortable. But I do think that the perspective that you draw from life and other life events and situations that you've gone through will help you manage that and go through that recovery a little bit quicker and a little bit better. So I think age does play a factor. It kind of evens out in the end in terms of the physical recovery and the emotional, mental recovery in terms of the age, but it's certainly not an overwhelming determining factor as an obstacle in terms of you reach this age, don't do it, because I don't think that that's necessarily the case. And again, I would go back to, the weight loss community in and of themselves, that mentality is very, very different. It's so positive, it's so determined, it's so motivated that no matter what we do to you, we're not going to slow you down. We're just not. We're going to put incisions all the way around your body, down your leg, down your arms, or on your breasts. You're going to say, all right, what's up next? We're not going to slow you down. So again, a long ramble to the answer. Age does make a difference, but it's not a huge impediment.
Wow, but I would have never thought that would have been your answer. And that is so powerful to know. And I'm so thankful I have not stopped recording yet.
Yes.
This happens every single time we do a podcast episode. Before we hit record, we have the most amazing conversations. It's like the pre-op and the pre-conversation. And I'm like, well, once again, should have freaking hit record as soon as
it's the same thing. It's the same thing as the very first episode. We recorded the whole thing without hitting. Well, we went through the whole thing without hitting record.
Oh my
God! The first episode,
something I would do.
The first episode was so good, and then we got done, and she looks over and she was like, "Uh-oh." I was like, "What?" She's like, "I forgot to hit record." I was like, "Okay, well,
right.
Run through it again."
Oops.
April, you're lucky. You're so cute.
I'm just shocked, April. That's very unlike you.
So you guys know me. You have seen my detailed show notes. You know how I run this thing. And the fact that I did not hit record, I was like, this is a sign, Jason. This is a sign it's supposed to happen.
I have seen your detailed show notes. I study them vigorously before every episode.
Yeah, I'm sure you do, Jason.
Everyone here has recorded. They all know, except